Chiropractic personal injury documentation and diagnostic guidelines. Really important, especially for chiropractors. Guidelines to winning personal injury cases. These are things that you want as much as possible. You want to be objective as possible. So we're going to pay a lot of attention to the objective test. We're going to pay a lot of attention to that. And knowing the difference between subjective, hybrid, and objective. That alone gives you credibility when you do talk about objective. Okay? Use as many third-party trusted sources. Why do we as chiropractors have to use third-party trusted sources? For you guys that aren't aware, you know we only have 8% utilization. Only 8% of the population looks for chiropractors every year. Okay? Not that more don't need it, but only 8% look. Okay? And chiropractic has a 67% negative name recognition. Why? It's not from the medical profession. It's from this thing called subluxation. When chiropractors promote subluxations, they say they can do everything. They say they can treat asthma, allergy, bedwetting, the immune system, cancer. And when you say you can do everything, you lose total credibility. You don't even get credibility for what you're good at, which is treating back pain. And that's why chiropractic does not own any category. Chiropractic is not the leader in back pain. Not even what we're really good at. We're the absolute best at treating mechanical back pain. And that's 99% of back pain is mechanical back pain. It's not cancer. So the very thing we're the best at, we're not even the leader in. More people see a general practitioner than a chiropractor. 55% of the people will see a general practitioner versus a chiropractor with back pain. Why? Not because we're not good at it. It's because we confuse the heck out of everybody by saying we can treat everything. It destroys your credibility. So you got to pay a lot of attention to this. So when orthopedists or neurologists or neurosurgeons talk, do they have credibility issues? Not at all. Do they try to claim to treat cancer in their immune system? No, they don't. Does a neurologist try to claim that he can treat asthma, bedwetting? You see, they stay in their niche and become known for something as opposed to be not known for anything. And that's what chiropractic is. There's absolutely no branding. Now, because of that, you have to go to third-party sources. Do you know who the #1 trusted healthcare profession is? Pharmacist. Pharmacist. But because you don't have credibility as a chiropractor, you have to use as much third-party trusted sources. In other words, when you do use sources, you want them third-party, meaning it's not your opinion, as much as possible, and you want to use sources that whoever you're communicating with, patients, attorneys, whoever, already trust that source. You gotta hijack their trust. That's what you got to do. Sorry. You know what I say? Thank you, Subba Wubba. Thank you, Subba Wubba. So, only use accepted science, no junk science. Remember, that's one of the 4 categories they'll come at you in the defense, the insurance company, is they'll attack that what you're doing is not medically accepted. Now, there's 3 common when we say medically accepted, what do we mean? It either is commonly used in the healthcare profession or it's in research journals. It's been proven in research journals. So you only want to use diagnostics and therapeutics, especially diagnostics. If you're going to say something's wrong, it better be medically accepted. It better not be smoke and mirrors, chiropractic, subluxation, station, wink, wink. You better not show up in court with a subluxation station. You won't even make it to court. You think an attorney wants you on court talking about how you help cancer and boost the immune system and treat allergies? You think that's going to help the jury? That's why you'll never get to court. You'll never get to court. He doesn't want that in court. And by the way, that's the same with that's the same reason most attorneys don't use chiropractors. They're confused just like the regular public, and they don't want that confusion in front of a jury. That's why they don't use them. Now, I call that opportunity, but that's also why advertising and publicity does not work, because there's no perceived need. And you have to use educational sales. That's why. So, you want to use as many third-party. So, use only accepted science, no junk science. So, what are the common 3 things chiropractors use? Surface EMG. That's junk science. It's not reproducible. Thermography. Neurocoulometer. And what's the subluxation station? 2 out of 3 of those. Surface EMG, neurocoulometer. They do, and then they'll test active range of motion with it. Active. And of the 3 ranges of motion, where's going to be the positive findings at MMI? Overpressure and joint motion, not active range of motion. Look how far off you're in la-la land with subluxation station. And people were buying them for thousands of dollars. Thousands, thinking that that was going to get them business. Stay away from junk science. Quantify, quantify, quantify. We do a test, we want to quantify. Even when you do an orthopedic test and the common finding, the industry standard may be positive or negative, we still want to quantify it. We want to add the functional capacity guidelines to it. 0, 1, 2, 3. We're going to add it to it. We want to quantify, quantify, quantify. Because quantify says everything. It says, what's the degree of the injury? Is the patient getting better? Are they getting worse? How fast are they getting better? How fast are they getting worse? Is it over? Did they heal 100%? Or have they healed permanently wrong? Quantifying tells all of that. And it establishes the need for care, by the way. And you need to establish the need for care to do what? Get paid. To get paid. So if you want to get paid, learn how to quantify. You want to learn how to win cases, quantify. State the purpose of the test, normal results. Anytime we do tests, we're always going to state what the test is, what does it do, and what are the results of the test. More visual, the better. The more visual, the better. 55% of how we communicate is visual, 36% is tone, only 7% are words. Everything you do, whether it's patient education, attorney education, the jury, we've got pictures, 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 pictures. Words are the worst form of communication. You never want words to be your primary form of communication. Like I'm talking to you right now, I'm relying on pictures. Guess what I'm relying on second with you? What?
Tone.
Tone. I will use tone purposefully on purpose. I'll go up, go down, depending on my audience, depending on what I want to emphasize. That's what will happen. The words are the last form of communication that I'm using to communicate with you right now. Use your medical team. And it's the same reason. Trust, authority, trust and authority, trust and authority. These are major factors. Guides to winning personal injury cases. The classic chiropractic personal injury patient is the minor impact soft tissue injury patient. It's the accumulation of multiple pieces of data into the categories to tell the story to win the case. It is not a grand slam. The typical chiropractic case is not one thing that hits a grand slam. It's the accumulation of these factors. Number 1, mechanism of injury. Number 2, injury magnifiers. Number 3, subjective correlative findings. Next, hybrid correlative findings. Next, objective correlative findings. It's about multiple factors. It's never about one. That's key. That's key. Rarely are there grand slams in a chiropractic personal injury case. Rarely. Combination of totally subjective, hybrid, totally objective cases. It's a combination of low and high sensitivity testing to support the case. Do not mainly use subjective, low sensitivity testing in junk science. Can you see now you're in trouble? If you use only and primarily subjective findings, low sensitivity findings that we just talked about earlier, and junk science, you're in trouble. You're in deep trouble right from the get-go. And how many chiropractors do that? Most of them. What's the good news? That's your competition. That's your competition. That's who you're competing with. There is no competition. And you don't know it. You think there is. There's not. How many chiropractors in your town? Yeah. Roughly. 40 or 50 chiropractors. Population what? 350,000. He starts an office. Immediately goes into 40, 60 visits within 3-4 weeks. Seeing 183 personal injury patients a week. All PI. All PI. What percentage of those new patients would be the 8% that called in a month? How many call in? How many call in from the 8% a month? 1, 2, 3? Huh? Say? Oh, you get about 8? Okay, 5 to 8. So if you didn't know personal injury educational sales, you wouldn't have those patients. And if you don't know educational sales, you don't get the 92% who aren't looking. So there you are. You would be in that town with 5 to 8 new patients. And then if you don't know how to keep them, now you're seeing 30 to 40 visits a week, right? And there you are. That's the typical chiropractor right there. That's your competition. That's what you're worried about. You're afraid of the attorney, and you're worried about the chiropractor because you have a one-pie mentality. You need to have a pie maker mentality. You make pies. You create it. That's the mentality. That's the skill level that you get.